Myocardial infarction is the medical term for a heart attack. This occurs when blood flow to a part of your heart is blocked for a long enough time that part of the heart muscle is damaged or dies. MIs are usually described based on the location of damage: anterior, inferior, lateral, septal, or posterior wall infarction. Most involve some portion of the left ventricle. Clinical manifestations: pain, severe immobilizing chest pain not relieved by rest, position change, or nitrate administration. Patients with diabetes may experience silent MIs because of cardiac neuropathy and may manifest atypical symptoms. Sympathetic nervous system. During the initial phase of the MI, the ischemic myocardial cells release norepinephrine and epinephrine. This results in vasoconstriction of peripheral blood cells. On physical examination, the patient's skin may be ashen, clammy, and cool to touch. Cardiovascular manifestations. In response to the release of norepinephrine and epinephrine, BP and HR may be elevated initially. Later, BP may drop because of decreased cardiac output. Abnormal heart sounds may also be present and may suggest ventricular dysfunction. Nausea and vomiting. The patient may experience nausea and vomiting. These symptoms can result from reflex stimulation of the vomiting center by the severe pain. Fever. Patient's temperature may increase within the first 24 hours up to 100.4 degrees Fahrenheit. The temperature elevation may last up to a week. Healing process. The body's response to cell death is the inflammatory process. Within 24 hours, leukocytes infiltrate the area. The dead cardiac cells release enzymes that are important diagnostic indicators of MI. At 10 to 14 days after MI, the new scar tissue is still weak. The myocardium is vulnerable to increased stress during this time because of the unstable state of the healing heart wall. By 6 weeks after MI, scar tissue has replaced necrotic tissue and the injured area is considered healed. In an attempt to compensate for the damaged muscle, the normal myocardium hypertrophies and dilates. This process is called ventricular remodeling. Remodeling of normal myocardium can lead to the development of late heart failure. Dysrhythmias, the most common complication after an MI. Any condition that affects the myocardial cells' sensitivity to nerve impulses can cause dysrhythmias. Heart failure is a complication that occurs when the heart's pumping action is reduced. Cardiogenic shock occurs when oxygen and nutrients supplied to the tissues are inadequate because of severe left ventricular failure. Papillary muscle dysfunction may occur if the infarcted area includes or is near the papillary muscle that attaches to the mitral valve. Ventricular aneurysms result when the infarcted myocardial wall is thin and bulges out during contraction. Pericarditis and inflammation of the visceral and/or parietal pericardium may result in cardiac tamponade, decreased ventricular filling and emptying, and heart failure. Dressler syndrome is pericarditis with effusion and fever that develops 4 to 6 weeks after MI.
A heart attack can happen anywhere, and it can happen at any time. Oftentimes, its consequences are very damaging and even fatal. Some of the most important things you can do for yourself to avoid having a heart attack is to exercise daily, eat healthy, and avoid high cholesterol. For further information, contact Oluluwal at MJS College of Nursing.